My name is Miguel Rodriguez, a family nurse practitioner student at West Texas A&M University, presenting an oral case study to the faculty at WTAMU and also my peers. I'd like to present a 17-year-old Hispanic female who serves as the primary historian and mother, uh, also to confirm patients' past events. She came in with complaints of persistent fatigue, mid-back pain, rated at 6 out of 10, a 50-pound weight gain over the past 6 months, erratic mood swings that started in January. She describes her mood as swinging from happy to sad, angry without any triggers. Her past medical history includes ADHD, which is managed by Adderall since age 13, uh, and hypothyroidism, which is treated with 75 micrograms of levothyroxine since age 10. She also takes ibuprofen for the back pain and cyclobenzaprine for muscle spasm related to the back pain. She's also taken Zyrtec daily, PO daily, for seasonal allergies. She has no known drug or food allergies. She remains active in extracurricular activities such as volleyball, tennis, and basketball, and reports that her back pain worsened after several falls during summer volleyball camp. Participating in the summer volleyball league. Surgically, she has had an appendectomy in 2013. Her family history is significant for hypothyroidism, obesity, diabetes, and RA on the maternal side, and ADHD and depression on the paternal side. Socially, she lives in Kermit, Texas with her parents. Her father works in the oil field, and her mother is a stay-at-home caregiver. Patient denies tobacco, alcohol, and drug use and is not sexually active and plans to attend community college after graduation. Voices that she is finished with high school and is ready to move on to the real part of her life. All the patient's basic needs are being met. She is on no special diet. All of her immunizations are up to date according to patient and confirmed by mother. Her last dental visit was in 2024 with no abnormalities reported. Her last vision screening was in August of 2025, which she does wear corrective lenses and contact lenses with no changes from the past 3 years on her vision screening. Mother does report that her hearing test was done in elementary school and she passed, and no further um, follow-ups regarding her hearing. On the review of systems, no positive findings other than the significant weight gain that has occurred in the last 6 months. Mid back pain. She denies any changes in skin, headaches, vision changes, respiratory or cardiac symptoms, GI or GU complaints, psychiatric symptoms such as depression or anxiety. She does report unpredictable night sweats and erratic mood changes that begin at the beginning of the year, and she noticed they've gotten worse over the past 6 months. Patient does not remember the last time that she had her labs drawn or her TSH drawn to check her thyroid level. Mother does report that she does not see a consistent primary care physician. The last one she saw was in Kermit, Texas, approximately 2 years ago, and she's been on the same dose of levothyroxine ever since. She received the cyclobenzaprine prescription from the emergency department, and she uses that medication PRN, 50 milligrams PRN, which she notes that is minimally effective and just puts her to sleep. Patient reports that the ibuprofen, 600 milligrams BID, uh, taken for the back pain is minimally effective. She says that her back pain gets to a 10 and it reduces down to about a 4 or 5 after taking the ibuprofen, but never fully alleviates. The weight gain, she does not report any special diets. She does not have a change in activity. She is very active in sports. Uh, on exam, she's alert and responsive. Her vital signs are within normal limits. Her BMI is significantly greater, uh, would qualify for morbid obesity at 40.7. She is 160 centimeters tall and 105.5 kilograms. Her skin is ashen but warm and dry with no lesions. Her head, ear, eyes, and nose and throat are unremarkable. Neck exam reveals an enlarged thyroid gland with rough texture but no masses or lymphodectomy, lymphadenopathy. Chest and lung exam is clear. Cardiovascular exam is normal with no murmurs or edema. Abdomen is soft, symmetrical without masses. Musculo exam shows poor posture with lumbar tenderness, but full range of motion and normal muscle strength. Neurologically, she's alert, oriented, and demonstrates normal reflexes and cranial nerve function. Developmentally, she's in Erickson stage 4 with no delays or no expected delays. Uh, my assessment is that HR has an enlarged thyroid gland with a history of hypothyroidism, significant weight gain without changes in diet or activity, and poor posture related to both her weight gain and sports activity and sports related injury. Her mood changes may be related to the hormonal imbalance secondary to hypothyroidism. There is a possibility that her levothyroxine dosage may need to be adjusted, though the timing of her last TSH level is unknown. Differential diagnosis for my patient include poorly controlled hypothyroidism, PCOS, Cushing syndrome, musculoskeletal injury from sports activity and poor posture, and possibly medication side effects. For my plan, I would like to order a CBC to assess for anemia, a CMP panel to evaluate electrolytes and liver function, a complete thyroid panel to assess current thyroid function, and a lipid panel to establish a baseline due to her significant weight gain. Imaging, I would include a lumbar spine x-ray to evaluate for structural causes for her back pain, and also would like to order a thyroid ultrasound to assess the enlarged thyroid with consideration for a fine needle biopsy if abnormalities are found. Um, I'll review her current medications, particularly levothyroxine, and adjust as needed based on lab results. Current dose is levothyroxine 75 micrograms PO daily. Possible titrate up if TSH medication, if THS is elevated. Reinforced education will be provided regarding strict adherence and to take medication on an empty stomach for maximum therapeutic effect. We'll also encourage mom to verify that patient is taking her levothyroxine as ordered and consistently for the max therapeutic effect. If her lab results return normal, if her TSH levels are normal, then I would expand on the endocrine lab, and I would try to rule out PCOS or order a cortisol level to see if it's Cushing's. Um, if if I'm unable to resolve her thyroid issue, I would make a referral to the endocrinologist for follow up. She'll continue her current dose of Adderall for ADHD. Unlikely that her mood swings and social withdrawal are side effects of her current regimen. 88, her Adderall does have a side effect. If not taken consistently and abruptly stopped, will have depressive mood and suicidal ideation. I will plan to do a PHQ-9 and assess for anxiety and depression. And if any of those tests come back positive, I would like to make a referral over to the mental health provider to help her work through those. But given her presentation, it's highly unlikely it's a side effect of her Adderall. I will have her to stop taking the ibuprofen due to minimal effectiveness, and I'll start naproxen 500 milligrams PO, BID, PRN as needed for pain management. She may continue the cyclobenzaprine for muscle spasms, but educate mother and daughter not to take this medication unless she is home, not to operate heavy equipment or drive, as this medication does have a high incidence of making you drowsy. I will also give her a no sports participation, no contact sports times 2 weeks to allow her back to heal. I'd like to see her back in 2 to 3 weeks to reassess the back pain to see if the pain management is effective. If not, then I may consider an MRI without contrast for a more in-depth evaluation of her back pain. And Also, make a referral to physical therapy for muscle strengthening, posture exercises. Um, and I will plan to contact the family sooner if results from the lab and imaging are abnormal or if it warrants a sooner visit. Um, I plan to also educate mother and daughter regarding lifestyle changes regarding her weight gain. Um, Also ask her to make a food diary so that way I may reevaluate so we can see exactly if it's truly non-diet related for her weight gain. Um, with her voicing that she is sexually not active, I would still want to confirm and verify that she is not pregnant. 50 pounds in the last 6 months is significant weight gain, and I definitely want to rule out pregnancy. And I will speak with mother and daughter regarding my concern. Uh, it's not that I don't believe the patient, it's that I need to confirm. Uh, Also, that's that's what we will do. Um, Thank you.